Good day, everyone. My name is Audrey Meguille Soyam. I am a DBA student at the California Intercontinental University, currently enrolled on the MGT 616 Organizational Change and Development in Management course. My course is facilitated by Dr. Richard Rignall. Today, I invite you to join my presentation on making the problem worse as presented to the senior administrators and management of Springfield Hospital. Thank you for joining us. Good morning, ladies and gentlemen, senior administrators and managers at Springfield General Hospital. My name is Audrey Meguille Soyam, Chief Operating Officer at Orbit Consulting Agency. Our agency specializes in working with medical facilities around the world to devise strategies and procedures aimed at reducing human and technological errors in their systems. Last year, through the World Health Organization, we engaged with hospitals, clinics, and surgeries in Asia, Africa, and Europe, and were instrumental in reducing the number of fatalities due to human error by about 26%. So it is indeed a pleasure to be able to share our skills, knowledge, and abilities with your organization. Hopefully, we will be able to come to a viable resolution to your existing problems. Enough about me. Before I begin, I'd like each one of you to introduce yourself by stating your name, your role, how long you have worked at Springfield General Hospital, and then share one fun fact about yourself. Let's begin with the gentleman at the back. Right. Thank you, everyone. That was fun. We had some very interesting fun facts emerging from the introductions, some of which we'll be pursuing over our lunch break. Back to our agenda. Over the next couple of minutes, we will examine some of the challenges that hospitals in general are facing here in the United States. Then we'll look at the specific issues at Springfield General Hospital. We will then look very closely at what could potentially happen if Springfield General Hospital does not seek an effective resolution to the current situation. We will look at the change management techniques and your role in managing the transition process effectively. Finally, we will look at the various teams and disciplines that must be parts of the implementation for the process to work. And then, of course, I will close this session by opening the floor to questions, comments, suggestions, and other workable solutions from you. Compelling statistics from the National Library of Medicine and the Leapfrog Group confirm medical errors as the third leading cause of death in the United States. Furthermore, these statistics indicate that such incidents are highest among older individuals, males, blacks, and those living in rural areas. Sadly, these figures continue to rise year in, year out, with an annual increase rate of 0.0058 per year. At Springfield General Hospital, unfortunately, the figures are just as unsettling. Recent figures from your data reveal over 770 cases of harm or fatalities to unsuspecting patients, coupled with a staggering financial bill of several $100 billion per annum. Ladies and gentlemen, senior administrators and managers, things simply cannot continue like this. Judging from the response I'm getting from the audience, I see a lot of you nodding. I can confidently say that you agree with me that this cannot continue like this. First of all, for many of you here today, this situation is in direct contradiction to your Hippocratic oath, first do no harm. I can safely say that you joined the medical profession to save and preserve life, not to end or destroy. Secondly, in your profession, one life lost is one too many. Not to talk about 770 lives in one hospital alone. Think of the devastating effect this is having on the families, the wives, the husbands, the children, the parents, who by your action have now become widows, widowers, fatherless, motherless, orphans, childless. Think of the financial burden your actions, albeit unintentional, is putting on the hospital. Monies which could have been directed to R&D or other innovative schemes are now spent on lawsuits and compensation. Think of the effect it is having on yourself morally, ethically, as a hospital, as an organization. Think of the reputation it is having on both you as an organization and you as administrators and managers. Again, I say this situation cannot continue. The changes I will be proposing today will be based on Kotter's 8-step change model. In the first instance, we create a sense of urgency. I think the fact that we are having this meeting is a step in the right direction. Secondly, we need to form a powerful coalition. This is done by involving as many stakeholders in the process as possible: patients, doctors, ward managers, pharmacies, family members. Pull these stakeholders together and brainstorm. Thirdly, we create a vision. This should flow from our brainstorming session. Once we are clear on where we want to be, we communicate this to the rest of the organization very clearly through a variety of channels: newsletters, posters, positive messages, meetings, press releases, whatever we can do to get our message out there. And then we empower action as our 5th point. Stakeholders at every level should be empowered to play a key role in effecting change. Each one should be made to feel that they belong to the team, and individual involvement is the only way of getting the desired results. And point number 6, quick wins. We create quick wins in one way. Creating quick wins is one way of celebrating success for every step made towards our end goal. Successes like a reduction in errors over a week, a month, or a quarter should be celebrated. It creates an atmosphere of recognition and success. And the 7th point, following on from that, we build on the successes. We ensure that we implement change one step at a time, so that it does not become overwhelming nor all-consuming. One way of doing this could be implementing change ward by ward, department by department, or floor by floor. That way we can learn from the teething problems and prevent reoccurrence in subsequent rollouts. Finally, once the change is implemented and rolled out, we stick to it. This is where, as administrators and managers, you then put new policies and procedures in place to ensure that the new work structures and systems are embedded in the corporate culture. Finally, I think the teams to be involved are the doctors, the nurses, the pharmacies, the administrators. By that I mean the data entry staff, data processing staff, and the medication dispensers. These are all key people who I think we should involve them in the brainstorming session, because they would bring specific perspective that could be vital in creating the vision that we will need moving forward. Thank you very much for your time. You've been a wonderful audience. And of course, if you have any questions, any suggestions, any comments, feel free to contact me. As always, my name is Audrey Meguille Soyam, and it's been a pleasure working with you today. Thank you.